Hi, everyone. Thanks so much for joining. Welcome to the Principled Interest webinar on applications of finance in global health. Thanks so much for being here. We'll get started shortly. In the meantime, if you're in WebEx, please note that all participants are muted. So please introduce us in the chat or introduce yourselves in the chat and ask questions throughout the discussion. Please take the poll so that we know who you are, and can learn a little bit more about you. Also, if you're having audio issues, there are instructions in the upper left box on the screen. And if for whatever reason you are having issues with WebEx, you can find the link to the slides in the calendar invite and follow us along that way. I'm your moderator, Priya Sharma. I'm the Director of Scalable Innovations in the PSC Hub, and I'll be your host as well. Let's see. So please, we will encourage you to use the chat. We'll address any questions live during the Q&A session, and if we can't get to your questions, then please know that we will follow up afterwards. And if you have any questions after the webinar, you can also email us directly at globalpartnerships@usaid.gov. And we will be recording this webinar, which will include a summary on market links afterwards. So if you miss anything, you can catch it afterwards, and also please feel free to share it with your colleagues who weren't able to join us today. So I think with that, we'll go ahead and get started. Thank you. So the purpose of the call today is to understand a little bit more about how finance is applied in global health. And I think this is still a little bit of a niche topic. So in particular, we'll dive into more about how finance can be used to improve health outcomes, how finance is being applied to global health priorities at USAID, and sort of wrapping all of this up with what we're learning, since this is a somewhat new space and a new application of finance in development. So we have some wonderful speakers lined up today, and I'm very excited to have them all here. We have Amy Lin, who's the Acting Director for the Center for Innovation and Impact in the Global Health Bureau, Jean Puce, who's a Senior Public-Private Partnerships Advisor in USAID Tanzania, and Christy Reagan, Chief of Party for USAID Invest. So thank you to all of you for participating today and agreeing to share your expertise and your knowledge. So Amy, I'm going to start with you. The Center for Innovation and Impact has been exploring this intersection between health and finance for a while. Can you tell us a little bit more about what finance looks like in the global health context, why it's important, and in particular, why is there so much emphasis on it now? What about trends and this particular moment in time is sort of making this such a hot topic?
Happy to speak to those, and I have some slides to accompany me exactly to explain why we think this is so valuable. It has been valuable, and it will continue to be, and how we can think about it in a structured way as we go forward to uncover opportunities. Would it help to just move into those, or here are the slides? Thank you for being so on cue. So as you mentioned, I lead the Center for Innovation and Impact, also known as CII, or abbreviated CII, and we focus on supporting and scaling global health innovations. We do this by applying innovative business-minded approaches to accelerate the development, introduction, and scale-up of those interventions across health areas. Any of our priority health areas for the agency, ranging from HIV to family planning to maternal and child health to malaria, and certainly these days to COVID-19. We do this in three ways: catalyzing innovation, scaling for impact or market access, and strengthening cross-cutting enablers like digital health. Today, I'm going to focus on that innovative financing component, as Priya had noted. But if you are interested in any of our work or learning more about it, please do check out our 2020 Impact Brief and our broader website with the links in the slides. Next slide, please. So the broader context of why this is so crucial is that while we have, as a community, made enormous progress on the SDGs, we still have a long way to go. And that was before COVID-19 hit. And as you can tell on the left-hand side, just from one indicator on maternal mortality ratio, we're not on track to meet the goals that we have set for ourselves as a community. And we will need new innovation and market access to achieve those. And on the right-hand side, you can see that this will require many things, and one of those is financing and additional resources. Official development assistance has plateaued, and we are still facing an over $100 billion annual gap, which will triple by 2030. Next slide, please. So one tool that we have at our disposal is thinking about blended finance and how it can help contribute to closing some of those funding gaps by engaging the private sector. We often hear a question about how can you define blended finance, and so we've taken a stab at a working definition here in that light blue box. Blended finance is the strategic use of public or philanthropic resources to mobilize new private capital or private funding for development outcomes. And this can help us overcome barriers that are currently preventing private capital from flowing into the low and middle income country markets that we are focused on. Where could this private capital come from? And that's on that right-hand side. In global health, this can come from a range of types of private sources. Those could be banks, impact investors, high net worth individuals, companies who work in the pharmaceutical or medical technology space, actual healthcare providers, equipment leasing firms, distribution companies, and more. This is intended to be indicative of the range of private actors that might be interested in blending their resources and financing with ours, but is not meant to be limiting. And on the bottom half of this slide, really looking at how this might be a different type of approach to using USAID capital. And so on the left-hand side, noting the traditional grant funding model with funding from USAID supporting an implementer in order to enable development outcomes that we're striving for. And on the right-hand side, having more than USAID contribute resourcing. USAID could still provide grants or TA, but also risk mitigation, facilitation, or results-based financing, and a private partner might also be able to contribute grant money, equity funding, or debt lending. This would then be combined into a blended finance instrument, so literally blending those resources together, that then still provides resourcing to implementers to enable, again, the same types of development outcomes. So the goals are the same. We are striving for health impact, and we're trying to see if we can broaden the pool of resources to get there. Next slide, please. So what does USAID bring to the table? Why would private interests be interested in working with us? And we've tried to organize these into 5 different types of advantages that USAID offers. We certainly have the funding or grant capital that we can use as a grant, but also to enable credit guarantees. We also have a vast amount of technical and programmatic experience and expertise in global health. We have a convening power and credibility across sectors, so across private, public, NGO, and FBO sectors. We have country presence and relationships with our field teams and mission presence. And we have an ability to influence and accelerate policy to take advantage of the dialogue that we have directly with government counterparts. Next slide, please. So we've tried to crystallize all of these concepts and a roadmap into a report greater than the sum of its parts. And this is available on our website and also a link on this page. And I'll walk through some of those key concepts today. But if you're interested in more, there's certainly more detail behind this. This is really trying to encapsulate the key findings. Next slide, please. One of the places we recommend starting with is to get a sense of what country archetype a specific context may fall into. And so we've tried to use a simple 2x2 matrix as shown here. On the vertical axis, thinking about the investment attractiveness of that context and the health system status on the x-axis. And we use countries here as the unit of analysis, but we could also have done it for subnational entities at the state or county level. And it's more to get at this idea to take into account these 2 factors as a starting point for considering what types of blended finance tools might be relevant for that setting. And so we've taken 25 countries, used publicly available data and indicators, mapped along these 2 sides, and all of those indicators are available in the report, to plot out these 25 countries and to show the distribution. And then we've roughly grouped them into 3 categories. The build at the lower left-hand corner, the strengthen in the middle, and then the transition in the upper right. And I'll talk through on the next slide how you can use these archetypes as a starting point to think about blended finance options. So let's go ahead and move to that slide now, please. So you'll see here in the middle with the 3 columns and the 3x3 table, a column for build archetype, a column for the strengthen, and a column for the transition. And this is just to get a sense of what types of blended finance tools could be useful for a country or a subnational context that falls into those areas. So under the build, perhaps it might be useful to think about grants for developing proofs of concept, development credit authority support to enable local lending for private enterprise, or milestone-based payments to enable inputs to be achieved. A strengthened context could look more at seed capital to actually enable a prototype to get off the ground, looking at technical assistance to the local banks in that system so that they can then lend to help social and medium-sized enterprises, small and medium-sized enterprises, or thinking about pay-for-success mechanisms anchored around output. And then on the transition setting or country, we could think about impact funds where investors might be able to be attracted to actually provide ongoing, structuring an ongoing fund or external lending right away. Thinking about a debt buy down to partially repay a loan conditional on achieving certain impact or health milestones, or an impact bond that enables outcome funding tied to health impact milestones. And again, I really want to emphasize this is to give a sense of the range of blended finance tools and how they might fall across different archetypes, but is not meant to be limiting. It's just meant to be a starting point that then is customized to the specific context that you might be thinking about for your health area. Next slide, please. So then if you have a sense of the country archetype as a starting point, that's our step one in the 6-step framework, where do you go from there? And we've mapped out 5 other steps that help to think about what other possibilities might be involved, and especially from a USAID context, but hopefully informative for other organizations and certainly our implementers as well. So step 2 is crucially to define the health issue that might be best served with a financing and blended finance approach. So really framing that problem statement well and thinking through what are the challenges underpinning it. And if then moving to step 3, thinking about the financing aspects of those challenges. If all of the financing needs are met, if all of the challenges are surmounted, but the health issue still wouldn't make much progress for other reasons, then that's probably not a good health issue to be focused on for a blended finance approach. We want to make sure that however the blended finance approach might unfold, that it can achieve substantial impact, even if the other pieces don't change as well. So that speaks to number 4, step 4, evaluating the potential for blended finance in particular. And this can be looking at the parameters noted here about whether an intervention could become sustainable, what would entice the private sector to become involved, and what resources could they bring to the table, and thinking about their resources in both funding as well as expertise and networks and channels. So if a health issue is identified, financing seems to be a core challenge, the potential for blended finance exists, then how do we actually shortlist a set of blended finance instruments? And that speaks to that table that I was just speaking to, but there are more tools as well that are described in the report. So really understanding what are the types of tools that might be available, how could they match to steps 3 and 4 in terms of the financing challenges to be met, and then the potential for blended finance to play a role. And then crucially, to identify how USAID could engage and how we as, with all of those different types of advantages that I mentioned earlier, can play a role in helping to catalyze in partnership with our implementers, and also with other stakeholders to get an initiative off the ground that can really meet these core needs. Next step, please. Next slide, please. So we developed this framework in partnership with 3 of our mission teams. And I know Gene is here, and he can certainly speak to the current, the experience of our collaboration in Tanzania and also the current situation today. We also worked with a team in India and a team in Liberia to think about how can we put this 6-step framework into practice. Everything from thinking about the archetype in Tanzania, sort of in that cusp of both strengthen and transition, to identifying specific healthcare issues, noting how the financing plays a role, exploring a multitude of blended finance options, and then anchoring them back towards the health impact that we'd want to achieve and the role that USAID could play. And in Tanzania, just to give a bit of a preview, thinking about how faith-based organization facilities were facing challenges around how to best provide timely and uninterrupted healthcare services. And this was before COVID. Thinking about the working capital needs that they faced, the limited ability that these facilities had in order to access loans from their local banks because of really high perceived risk, and then an opportunity after sifting through many different options of creating a revolving fund or other type of standing facility to enable working capital and organizing around the faith-based organization structures that already existed. And then, of course, anchoring towards specific outputs, outcomes, and impact that would be focused on health indicators. Next slide, please. I also wanted to bring it up to date to the current day. I've mentioned a couple times that a lot of all of this analysis was done before COVID-19, but that doesn't mean that it's made obsolete because of the pandemic. In fact, we can use that same framework and the same approaches to exploring needs today. And one example is the Open Doors African Private Healthcare Initiative. Next slide, please. This initiative, or ODAFI, it confronts the dual crisis that African private small and medium-sized enterprise and healthcare providers are facing today. On the one hand, and this will probably be no surprise to this audience, there's a severe public health crisis. Half of sub-Saharan Africa is relying on private healthcare providers. The cases of COVID-19 are leading to a dramatic spike in hospitalizations, and the continued lockdowns are affecting life-saving healthcare delivery, not just for COVID-19, but also for malaria, for maternal and child health, and many other health areas. At the same time, these same SMEs are facing a financial crisis. Their revenues have dropped by 40% since March, so in the last year. The government lockdowns have disrupted their cash flow. Patients are concerned about visiting health facilities in the middle of a pandemic, and these SMEs are too small to be able to attract commercial lending, and they're too big for microfinance. And so they're getting stuck in this financing gap in the middle. Next slide, please. So what this Open Doors initiative is seeking to achieve is to stabilize these clinics during this crisis with a loan guarantee that enables working capital to be accessed for them. And so it's using a $20 million loan guarantee that's enabled by foundation and PMI funding to then unlock up to $35.5 million that can be issued in loans to these health SMEs in 5 countries: Ghana, Kenya, Nigeria, Tanzania, and Uganda. This is a coalition that's bringing together all of those organizations at the bottom in partnership with ourselves, PMI, and the Development Finance Corporation, and really is seeking to enable ongoing operations by these SME providers to procure PPE and other equipment that's critical to enable their operations, and so that they can continue to provide essential health services, including malaria diagnosis and treatment. They will also receive not only the funding from these loans, but also digital training resources from MCF's sister organization, SafeCare, on COVID-19 and malaria. Next slide, please. And then finally, to wrap up, I've talked about the current need for ODAFI and how the financing approach and partnership has come together to address that. But I really want to end with the health impact. And the goal here is not to be able to create a working capital facility or to have a new partnership. The goal is to keep 1,600 healthcare facilities running and providing life-saving services to over 5 million patients, with other sub-indicators listed here as well. Let me pause there, and I'm looking forward to the rest of the conversation. Thanks.
Great. Thank you so much, Amy. I think, Christy, we'll turn it now to you. So Amy has sort of helpfully set the stage at that 30,000-foot level to help us understand how the Global Health Bureau is approaching blended finance and health. Can you tell us a little bit more about what you're seeing across your portfolio of missions at Invest? How has the pipeline of work in global health evolved over the past few years and more recently pivoted to address the COVID pandemic?
Sure. Thanks, Priya. And thanks, Amy Lynn. I love being on a panel with her. She always does the heavy lift, especially on a tough topic like blended finance. I think the first point I'd want to make is that roadmaps, as we know, they can get you to a very specific destination, but they can also just familiarize yourself with basic geographies and the lay of the land. And in this way, they can become a general learning tool. They can actually build capacities along the way. And I know back in the day when there were paper roadmaps, many of us, like myself, used to lay around and look at these and learn a lot in the process. And I think the Global Health Roadmap was just like that. It was certainly a diagnostic tool and a programming tool, but it was also a learning tool. And of all those 3 deep dives with those missions, India, Liberia, and Tanzania, I think it's not a coincidence that all 3 of those missions ended up launching blended finance activities in economic growth, telecoms, banking and remittances, education, WASH, and yes, we even had health activity. Jean's going to talk more about that specific journey with the Tanzania mission, but I'm just going to take a side road here and elaborate a non-health funded blended finance activity supporting health outcomes in Vietnam, and I'm going to elaborate on non-health funded COVID response activities supporting health outcomes in Afghanistan. And the point I want to make is that health is foundational, and because it's foundational, it can deliver a real impact using these blended finance approaches, maybe even more than other sectors. And they can address health problems, they can deliver health outcomes, and they don't necessarily have to use health money or be driven by the health sector, but they're usually very linked, supported, and guided by health teams, health experts. I would also add that the response to the global pandemic has confirmed at least one inviolable truth, and that's that innovative solutions and the funding for these must come from many different directions and many different sources. As we've seen in the U.S., the price tag for the pandemic is so high, it cannot be borne by the public sector or the private sector alone. And this is a challenge, but it's a huge opportunity for catalyzing these new approaches that bring new funding from other sources. Next slide. And I just want to show you what this looks like in numbers. So INVEST is just one of several global buy-in mechanisms that are managed out of the private sector engagement hub in the newly set up Development, Democracy, and Innovation Bureau. For those of you who like the acronyms, that's DDI. The focus is on mobilizing private capital. It's very broad, and it's not as scary as it sounds, and it offers all sorts of entry points. And I'm just going to give you a few examples of kind of the breadth of what you can do under this. Just with these numbers, I want to just make a couple of points. Yes, INVEST has a reasonably large buy-in ceiling of 167 million, has 55 different buy-ins. Those are major engagements from across USAID, and it works in 64 countries. But what's really interesting is that 20.3 million is focused on health or COVID response, and 19 of the 55 buy-ins are focused on health or COVID response, and 26 countries are working on health or COVID response out of the 64. I think those are fairly sizable percentages, and what's even more interesting is that of that 20.3 million that's funding health impacts with blended finance solutions, that's nearly all coming out of non-health sectors, particularly economic growth. And of the 55 buy-ins, we've really only had 3 that have had health, actual health money coming in. But what do those numbers mean? I think it's a recognition that health and COVID response are critical issues, and they do, again, as I said before, they require blended finance, finance and investment solutions, and they can't just be addressed if they stay in one sector with one pot of money. So what does this look like concretely? I'm going to tell you about Afghanistan first, and then I'm going to tell you about Vietnam. So let's move to the next slide on Afghanistan. Afghanistan is a COVID response challenge. The mission wanted to work really quickly. They wanted to do blended finance. They had a $15 million buy-in. That's Afghanistan. It's big. But they only wanted to use a small amount, not around and not more than $1 million for technical assistance. They didn't want to get into a direct investment kind of activity, and they really wanted to focus on the local firms, and they wanted to use this to connect local with international, regional, and other local actors and investors. They really feel that the COVID solution is in local. So let me give you a glimpse of what that looks like. Just 2 sentences about the problem. 10 million people, or a third of Afghanistan, are confirmed as having had COVID-19, and that's, of course, underreported. The small amount of testing led to premature reopening of businesses and further spread. You know, it's the classic problems they're seeing. There was no hand sanitizer of any quality. There were no disinfectants in the country that were really highly effective against the COVID germs, and they were very cost prohibitive. And that meant there was no management of COVID through PPE. So the mission launched a medley of several different approaches, kind of scrappy, very quickly launched, and they all involved private sector, particularly local private sector, and they used technical assistance to position local firms to get the investment. So I'm going to put these in three different pots. One is kind of pre-investment positioning, one is sustaining investments that have already been made, and one is maximizing investments that were currently being made. Let me just take the first one. Thank you for the slide. The pre-investment positioning, that was all around targeting some local private sector firms that could produce and sell safe, high quality, effective hand sanitizers and disinfectants. And then in doing so would make them much more attractive to investment dollars. We actually brought a Florida-based global private sector firm called Global Venture with a background in investment, mostly in natural resources, but they really knew Afghanistan, they knew local actors, and they put together a plan to identify, strengthen, and market local firms that could produce and sell reliable hand sanitizer. We also helped provided them with quality advice on quality production and reliable formulas and safe formulas, and got them investor ready, if you will, for that local finance to come in as they grew. The other area that we tackled with Global Venture was also designed a private sector-led approach to facilitate, in this case, a partnership with U.S. and global leading brands producing very high-quality disinfectants. And those, we've identified 5 of those major global firms who are interested in setting up processing and production in Afghanistan about quality, safe products in disinfectants that even would be available to hospitals to use. And why would a global brand want to start such a production line in Afghanistan? No competition at all, very easy market entry, and not much risk once the missions helped identify the best local and vet the best local enterprises. They see it as a low risk proposition. So that is just on pre-investment positioning. These firms in both hand sanitizers and disinfectants are being set up with technical assistance to grab those investment dollars. But we also looked with the mission at sustaining investments, keeping successful businesses from collapsing, working through local business associations, in this case, the Afghan Chamber of Commerce, which covers 90% of the Afghan workers and 65,000 local businesses in 25 different provinces. We actually put together a whole package of technical assistance to get the advice out to businesses to keep those that have been investing in, many by the mission itself, to not collapse, to not go bankrupt through this COVID. So that was another set of technical assistance. Then finally, I just want to briefly touch on the last category, which was maximizing the impact of current investment dollars. Through technical assistance, we identified a local green firm that had already made their own investment in renewable solar chiller technology, and they were going to use this to help with agriculture storage, but immediately they were going to use it for vaccine distribution, which is very important because this week Afghanistan got their first vaccines, and they want to cover, they can only chill 5 million and they want 32 million vaccines. So they need these chillers, and we're just helping, again, a firm that's already made a local investment to use these for vaccines, but also later for agriculture. And I want to jump really quickly to Vietnam because I know I'm just at time here. Next slide. Yes, Vietnam is actually tackling a key health challenge using economic growth funding, and that's declining PEPFAR funding, which is sustaining the provision of local services and doing it with finance and investment solutions. The challenge is, like a lot of places, you've got a lot of community-based organizations that are providing the PEPFAR services. They've basically been donor funded. How are you going to maintain those services now that PEPFAR and other donor money is declining? And the solution in this case was going in and bringing a private sector firm again to come in and design blended finance solutions, a mix of local ownership that would help these firms get new business models. And would you go to the next slide? And I'll be wrapping up. And so in this case, we're going to be looking not only at private sector design, but we're looking at two funds possibly. One is a technical assistance fund that could help these firms trial these new business and finance models. And the other one is to actually set up an innovation pilot. So one will be building their capacities, and the other one will be injecting some resources through investment funds into these firms that can actually sustain their PEPFAR services, their HIV/AIDS services, especially to these key populations of sex workers and former drug users. So here's just two examples about how, in this case, non-health money was used to address health outcomes, one around COVID and one around PEPFAR sustainability. And I'm going to stop there at time, and I will look forward to hearing from Jean back on the deep dive of a roadmap. And back to you, Priya.
Thank you so much, Christy. You know, for me, it's always exciting to see how your pipeline in health has grown over the last few years, and in particular, how you've been able to adapt a lot of your work to address COVID. So, Jean, you're gonna help bring this home for us. I think your activity has been teased quite a bit by our previous two speakers. You sit in the health office in the mission, but you're leading a blended finance activity that has the potential to improve health outcomes in Tanzania. Can you tell us more about this work, how and why it started, and how it fits in with the rest of your portfolio in health at the mission?
Sure. I have two short slides to tell my story. Can we have the first slide? One of the issues that we face in Tanzania is that the government of Tanzania is now beginning to withdraw its service level agreements with the faith-based hospitals. Since Nyeri, they've always gotten support from the government because the government's position was, if there's a faith-based hospital in a public area where we do not have a facility, we will second staff to the hospital and we'll pay for the services under an agreement for specific services. The problem is that the government is beginning to withdraw those service level agreements. And because 40% of the hospital system is owned by the faith-based system, Christian Social Services Commission, that puts at risk the national health system. Not only that, 40% of all the hospitals involved in the PEPFAR program are CSSC hospitals. And almost all the health centers of CSSC is part of the program as well. The other potential risk is that the existing public health network already is understaffed, poorly maintained, fairly dependent on donor support. So we have two big potential risks here, is that the faith-based hospitals are under incredible financial pressure as the government withdraws their support. And the other risk is that the national health system may collapse. And the PEPFAR program, which I'm mostly funded by, is going to suffer some real big losses. So we're going to have to find some ways of developing a new business model for CSSC hospitals, and also to source some capital, because that is always the primary constraint. Now, we've had a little bit of experience in blended finance, although limited to DCAs. 5 years ago, I was able to implore upon my EG colleagues to get some money and some other sources of funding to put together a 2.8 DCA in health with a major bank in Tanzania. The first 2 years, not much happened. Then I relied on SHOPS Plus. They had a good team here, and they could access a person from Washington, D.C., and a local Tanzanian who was familiar. So it was not utilized for 2 years. They came on site, and within 24 months, that 2.8 was out the door and well used, and there were no defaults. The bank itself, for the first time, said health is a profitable place to be. they asked us for a 10 million DCA. Again, I could not access money from PEPFAR, so I had to go around and find other means, and our colleagues in the DFC were great people to work with. A big shout out to them. They've been working on getting some money, and they got enough money so I can at least get an $8.1 million DCA, and they've been working very hard to get this in place, and I have a lot of respect for what they're doing. The Shops Plus people also helped me because these people could speak the same language as the bank, which I could not do. And they also were smart enough to be able to find the biggest supplier of medical equipment in the country. They provide about 60% of the equipment, and they established a buyback guarantee, which all of a sudden made the bank much more comfortable as well. And now other banks are beginning to show interest. So I was dabbling in this, but I wasn't even know it was blended finance. I was just trying to make things work. Next slide. So here's the story. In early 2018, I was having a conversation with Amy Lynn about Shops Plus. She then informed me about some blended finance solutions, and because Tanzania rated on that chart where it was sort of middle income and a medium score on the health system side, we were a candidate. So she introduced me to Priya, and we had some conversations. In August 2018, Amy led a team into Tanzania to do a deep dive. That was absolutely critical to me because I was at the same time beginning to develop a bilateral activity. When they did the deep dive, they not only looked at the blended financial solutions that were possible, but they also pointed out other areas that needed support as well. So that helped me define the bilateral activity that I was designing. Then we go to December 2019 when they announced the Finance for Self-Reliance Initiative or concept papers. I put in a concept, submitted it, and we're able to get some money. So then I could build on what was done earlier. And in September 2020, we had a team, a consultant here, found a local consultant to take a look at that study to see if it still was valid. The bottom line, it is valid. Although we got more clarity, particularly on the bilateral side, what we need to do. And you see that in the second column. So now we have a bilateral activity. I'm getting external support to set up the blended finance solution. So that's one thing I don't have to worry about. I know other people will take care of that. So I can concentrate on the bilateral activity and get that implemented. And so that's where we are now. So we're just at the beginning stages. And I would be at a loss if I did not have that component one and the support for that, because if I can get that in place, I have no fuel for the tank to move forward. So it's been really fun working with them. And I hope in a few years we can report back some good stories. Thank you.
Thank you so much, Gene. It's been a pleasure working with you, and it's always exciting to see more and more champions for this type of approach at USAID. So, Christy, I think you had a question that you wanted to ask Gene, so I'm just going to tee that up, and then I would love to bring both you and Amy into the larger conversation about the Tanzania activity.
Yeah, thank you, Priya. Oops. Let me get my video. I did want to, this picks up on actually a question that's in the chat about why isn't there more funding? Why isn't there more work taking place in health, out of the health sector and the health teams for blended finance approaches? And I do contend that overall there's still a lot more that can be done, but part of this is just gaining a familiarity, and it's a risk to go into a new area. And I'd love, Gene, to hear how has the deep dive and how is this work that you're doing on faith-based hospitals, even though it's small, do you feel that it's bringing the mission along about the possibilities for blended finance at the mission level? Are capacities being built? Are light bulbs going off? Or is that a little bit too dramatic? But is there small change even?
No, there definitely is an increased appreciation for the private sector. And we have a very active private sector engagement working group that crosses all the missions. So that's not the issue. The real issue is that we rely so much on PEPFAR funding. And PEPFAR still is a heavily public sector oriented program. And so, like I said earlier, for me to get money from PEPFAR to establish a DCA, it's very difficult. Can't do it. You can see earlier that PMI is doing that, but PEPFAR is difficult. So that's what the problem really is our constraints around that. Secondly, when you're building health systems, it takes time, and you don't see results right away. And a lot of it's soft stuff, like you see on the bilateral activity. Right now, where we are right now is getting the hospitals to take another look at their board of directors. Do they have someone on the board that knows finance? Or do they have people that are just associated with the hospital? I mean, with the faith community. That's where we are, and that takes time. And PEPFAR wants to see results on targets. They want to see some real downturn on the epidemic control. So we're living in that kind of world. So the group that's financing me, although they understand it, but when it comes down to it, you have to report results against the HIV epidemic. And we're not going to show results that fast. It takes time to build systems. But everyone in the mission is supportive. I had no problem there whatsoever.
Priya, could I comment on that for a minute?
Yeah.
Yeah, go ahead, Amy. Thank you.
Maybe I'll just pick up on exactly what Jean was saying, and thank you for walking us through that history and the kind words, Jean. We've really enjoyed the partnership throughout. I just wanted to pick up on the qualities you were just speaking about, that it takes time. And I think your leadership in this space and driving this forward has really demonstrated the importance of sort of an entrepreneurial patience. You have to be patient and keep the long view and think about, putting all the pieces in place, but you also have to be entrepreneurial and scrappy and find funding and opportunities from different places. And so I think that long view, but combined with really productive persistence, it has enabled this to move to fruition. I also wanted to recognize Priya's leadership on developing that blended finance roadmap, just as Jean was speaking to. So Priya, I will also invite you to chime in, as I see you also have already started in the chat, since it was certainly a co-developed model there. I also saw a few interest areas as I was skimming through the chat about other opportunity areas, and I really agree with how Priya was already chiming in, and just wanted to emphasize that there are more opportunities than in just these 3 deep dives that we happen to have done. So we would welcome hearing interest from other country contexts or country partners. My CII colleague Sylvia is also on this call, on this webinar, and so please feel free to reach out to either of us if you see an opportunity that resonates with you from what we're speaking on today. And that's including across sectors, whether it's WASH and nutrition or other health programming. And then just to also emphasize what Jean was saying about the DFC, or the Development Finance Corporation, as a really important partner that is on the stage now. They have launched their Health and Prosperity Initiative. They are very eagerly looking for ways to add their tools and resources to achieving health outcomes. And so CII is the liaison there for the health sector, but we really welcome that collaboration as we think about possible opportunities to partner with them. And then finally, I saw a quick question about dengue, and while it's only peripherally related, I just wanted to note it in case there's interest more broadly. The Zika advanced purchase commitments that Priya led and also is part of CIA's portfolio in partnership with our ID colleagues, was looking at how can we accelerate the development and access to rapid tests for Zika, and especially multiplex tests that would also include dengue. And so we have found ways to use some of these market incentives and market shaping approaches for the dengue space. And then one quick plug on our CI website, if you're interested in learning more, you can watch Priya's avatar in our Blended Finance Innovative Financing webinar, and that's available on our website. Thanks, Priya. Back to you.
Thanks, Amy. If anybody does take that training, please don't tell me about it. So we've had quite a few questions come into the chat, and I think there was one in particular that I would love Love to get everybody's input on, and so no particular order. Whoever wants to chime in. Christy, I think you did. You took a stab at it in the chat, but it was in response to your point about taking an integrated approach and how that's important for us to not only achieve health, but all development outcomes. And I think it was more, so the question here specifically is around, why aren't we seeing, why is health funding sort of a small proportion of the overall investment that is happening in INVEST? And, some of the limitations that we hear, some of the concerns that we hear around health funding in all of the different forms that it exists at USAID sort of can't be used for particular activities, and how do we overcome this barrier, this obstacle, and actually start to use it to build out some of these more cross-cutting systems like the financial sector, ensuring access to credit, et cetera. So Christy, not sure, maybe if you wanted to kick it off and just provide a little bit more color to your question, then happy to have Amy or Jean take a stab at it.
Sure, thanks, Priya. I think I would just come and make two comments. One, the global pandemic is huge, huge challenge, but it's a huge opportunity to bring this kind of systems thinking home. I think what we've seen is, and we are seeing right now is, yes, the vaccines were developed by the private sector, they're fabulous, but without the public sector, that actually innovation can come from the public sector. And I think the public sector needs to get more comfortable with this idea that they can be an innovator. And the other thing is that, on INVEST, we don't actually attack the systems, at the policy regulatory, but what we're finding is by maybe doing one transaction with a health enterprise, by getting field intelligence in Nigeria, $130 million in investment, we're able to see it illuminates challenges in the system and the policy regulatory work, and then and the missions can follow behind that. So we tackle systems maybe in a more manageable way, and maybe it's like trying to eat the elephant. We're taking one bite, and it's helping us through getting an investment into a health pharmacy enterprise to see all of the other system changes that need to come. I'll stop there.
Great, thanks, Christy. Amy, Jean, either if you want to jump in with a thought.
I'll add in. I love Christy's metaphor of thinking about eating of an elephant. That does sound like a big undertaking, but I agree that it's a big project, and it's got to be one step at a time. And each of those steps can be impactful and also a demonstration. And so that demonstration effect can help us uncover those opportunities. So, for example, with the work that Christy was just speaking about in Afghanistan and Vietnam, with Jean's work in Tanzania, how can we not only celebrate what they're achieving in the near term, but also how they help demonstrate how USAID and its partners can play a role in paving the way to think about more blended finance opportunities and encourage others to look at their health challenges through a financing lens in case blended finance could be an approach there. I also really wanted to underscore what Christy just said about the public sector can be innovators. I don't think we need to concede that role only to the classic view of a few people working in a garage. We can all be innovators and take new lenses in exploring the challenges that we face. And one of those lenses can be around whether or not a blend of different types of capital, whether it's with private investors and the DFC or other forms, can help us address a problem that we're facing, especially when we face so many today with the COVID-19 disruption. Over.
Yeah, I would just add very briefly, it's interesting how you get involved in these activities and you have collateral effects that you don't anticipate. As I said, once the major bank got involved and they actually had a 2-hour Zoom proclaiming the private health sector as an investment priority, that kind of raised the whole discussion area. And now all of a sudden we have a microfinance institution that is now giving loans to the very small drug dispensing outlets. And so it's kind of like the health sector becomes a topic of the day right now. And it was a very simple thing. Our implementing partner just had a conversation with the head of the microfinance institution, introduced them to all the work they were doing in the drug dispensing agency, and all of a sudden we've got loans going on. It costs us nothing. It's just the time of the implementing partner for a couple of meetings, and it's in place. And it's all about, all of a sudden, health is kind of an area that looks interesting in an environment, quite frankly, that is not very private sector friendly at this juncture. Over.
Yeah, thanks, Jean. I mean, I think that just brings home sort of the power of the demonstration effect, but then also, you know, how much of an impact USAID and its programs can have. I mean, it really sometimes can be as simple as a conversation. You know, using a tool such as the former DCA, which now exists with our DFC to help de-risk a little bit. So, you know, I think we're playing the long game here because health isn't necessarily seen as an investable opportunity by the private sector, either commercial or otherwise. And so a lot of what we're doing is foundational, is, you know, working towards addressing some of those systems that are cross-cutting, but also just demonstrating and sharing perhaps some of the risk with private investors to make them understand how the health sector operates, where the risks are, how to price that appropriately, but then also not to overestimate them, because I think sometimes that's a problem that we see. So we've had a lot of great questions, and we have some of them already being answered in the chat. But I wanted to bring up two. I think, Christy, you might have something to add here about some of the work you're doing through Invest, about blended finance being used to support nutrition and climate change. So I took a stab at that. I know we are doing a lot of work in the climate change space, or globally there's a lot happening, but I think there's some work with Danone that you're doing that might be interesting for our audience to hear about.
Yes, we are. Let me just make a general comment that, you know, we've thought about corporations really just, they'll use a little bit of their CSR, corporate social responsibility dollars to come in and do something. It's kind of small, actually, and a bit marginal often, and maybe just one company. Danone is actually piloting a new model with USAID, with some water and Africa Bureau funding around new models for corporates that involve corporate investing. And we're hearing this from other corporates, not just Danone, but they're a leader on this. They're looking at setting up a fund that can make investments. We're supplying some small amounts of legal advisory services. And these are little ways that technical assistance can come in and unlock other larger amounts of capital. And the Danone Fund is one of these. We're looking at other models where corporates actually come in and catalyze a fund. Kiva Capital is doing this around gender, and they have been a very small, you know, kind of democratized investment model, if you will. And they set up also a fund to now make investments into, you know, gender-led businesses, gender-smart businesses, and it's a corporate taking the lead here. So these are really exciting models where then USAID could come in with small amounts of maybe it's technical assistance to help design the fund or recruit the right manager for the fund, or set in the legal authorities that will help sustain the fund. So that's an example of corporates leading the way on new investment models, and USAID coming in with some TA there.
Thanks, Christine. And I think that's an important point because, you know, as USAID sort of seeks to, I think, more systematically and strategically implement, you know, private sector engagement into its programs, you know, one of the things that we are trying to emphasize is, you know, this shift perhaps away from philanthropy and CSR as the kind of only way or the only parts of, you know, commercial entities or private sector entities that we can engage with, and really start to move towards more of that commercial, the commercial parts of organizations. And so it's great when we have examples of where and how this is already working. You know, I think we've gotten through most of the questions, and of course, as I said, we will continue to respond to these in our summary. I did, in closing, perhaps in the last few minutes, want to ask our panelists two questions, and you can answer both or either one. But, you know, given that blended finance and its application in health is so new, I'm curious what you see as kind of barriers or challenges to scaling this approach globally, and even perhaps within USAID, And then on the flip side, what opportunities do you see? And maybe, Jean, we'll start with you.
Well, because we're at the early stages here, and because I live in my little world of Tanzania, I don't have the global perspective of Amy or Christy or you. So in my little world that I'm working in right now, if the DCA comes out soon, it won't necessarily be part of the blended financing solution we're looking for CSSC, because that rotating fund has to be something quite different and a different mechanism has to be set up. But by just having that DCA come online from a 2.8 to 8.1, is adding more capital going into the private sector. I just think it helps. Even if it doesn't go to the faith-based and it goes to the for-profits, it's fine with me. Although we're going to try to get the faith-based to participate in it, but just moving more money into the private health system, in fact, will be good for the faith-based system as well. So the more we can strengthen that private health system, all the better. So that's where I'm living right now. And of course, again, my concern is all the other parts of standing up the bilateral project and getting the system to really work. Again, I'm letting you as experts take care of the blended finance side. So, over.
Thanks, Jean. No, that's really helpful. And I think you're right. It is about, even just seeing that shift from the DCA that you had previously and now the credit guarantee that you'll be getting through the Development Finance Corporation, that change in size and even the bank's demand and willingness to work with you on something bigger, I think just kind of shows the power and the opportunity that exists, once we're able to demonstrate the viability of the private health sector as a strong market for investment. Amy, perhaps your thoughts just from where you sit in the Global Health Bureau?
Sure. I'm happy to opine on the very big questions that you laid before us. Although, Jean, I think your caveat is too humble. Your little world of Tanzania is the crucial on-the-ground perspective where we're all trying to support you all and those on this call to make an impact. I think from the broader sort of multi-stakeholder perspective that some of the conversations we're a part of, some of the big barriers would actually be around too much expectation setting around what blended finance can do. I think we have to make this a fine balance between noting it is an opportunity and it is a tool that we need to be considering, and it's also not a tool that will fix every problem. And I think that's exactly why we wanted to develop and share this blended finance roadmap to make sure that we are anchoring any tools in a health challenge that can really be addressed substantively by financing. And so I wouldn't want outsized expectations that blended finance can solve every problem to then undermine its ability to solve the many problems where it can play a role. So I think the right sizing of the expectation, making sure we consider it consistently, but not apply it in every situation is one barrier that we're going to have to make sure that we have that nuanced view as a community. And that we also value all of the other technical assistance and components that are not related to financing in order to make progress on health challenges. On the opportunity side, I do think that new actors like the Development Finance Corporation and new investors who are newly interested in health is a huge opportunity. I think investors who have been a little bit sitting on the sidelines, thinking about impact in different ways, are increasingly interested in impact investing overall and in health in particular. Nobody could escape global health this past year as we've been thinking about the pandemic. And I think we should take advantage of that new interest among investors and private companies, as well as among all of us, to explore blended finance opportunities more proactively where they make sense. So I'm excited about that opportunity, and I hope some of you who are here today, if you see this resonating with some of the work you're doing, please do reach out to Sylvia and me and Priya, as we've all been noting, because we would love to brainstorm and work more on this together. Thanks.
Thanks, Amy. Christy, any final words of wisdom that you can share with us, and then we can let people get on with their day?
Yes. I would just say the big challenges are, let me just celebrate or at least point out the small and the maybe mundane. Just information. A lot of these investors do not understand emerging markets. We're trying to bring some big U.S. pension funds to Africa, And it's amazing the perceptions of the investment opportunities in Africa still these days. We all work in development. We don't think that's the case, but it's out there and it's deep, and we need to just get more information around. And the second I would say is operational. If you want the private sector to come and help you solve the problem, it's a big challenge to move quickly enough, to move in ways that meet the private sector expectations. We got to move fast. We got to be clear. And we can't throw a lot of bureaucracy at them. And then just for the opportunity, I would say we just did a big assessment in Moldova before COVID started. And we had wine and agriculture and tourism. Those were the big opportunities. We redid that assessment a few months later in COVID, and it's health and it's digital. That's where the investment opportunities are right now at the enterprise level. And I think that's going to continue. So I would say those are the challenges and opportunities.
Thanks, Christy. So thanks to our panelists for joining and for sharing your perspective and expertise today. And thank you to our audience and for all of your insightful questions and comments in the chat. As we said, we will be, this webinar has been recorded, and we will be sharing this recording with all of you sometime next week, along with a summary and responses to any questions that we didn't get to. So thank you very, very much for joining, and we look forward to hearing from you in the future. Thanks.
Thank you, Priya.
Thank you.
Thanks to all the organizers. Take care.
Thank you, everyone.
Thank you.
Stay.